Welcome to the office.
Hi, Jennifer.
Hi.
Welcome to the office.
Nice to meet you.
Nice to meet you too. So we have some things to talk about. What brings you here?
I started about 3 years ago with severe pain in my legs, and it started when I came off of anti-anxiety medication.
Okay. How long were you on anti-anxiety medication for?
Since I was 14 years old, and I'm 29, so
15 years?
15 years.
And why did they put you on anti-anxiety? You had anxiety?
I had anxiety. I was graduating, I was starting high school, started with anxiety through the whole college years.
Okay.
Really bad
What does that
anxiety.
mean though? Because it's a common thing
it
these
is common.
days, right?
Yeah.
Anxiety, or the term even anxiety.
Mhm.
But what does that mean to you?
Mine was more debilitating, where I couldn't go spend time with my friends. I kind of suffered a little bit from separation anxiety from my parents,
Okay.
and had trouble just getting through school, doing tests, all of those different things.
Okay.
Found out my family, but myself, was going to a doctor who was overprescribing. So I was on very, very high doses of medication without really getting any other assistance.
How long were you being overprescribed?
Since I started.
Since you started?
Yeah.
Okay. And how many years before you figured that out?
It wasn't until I started to I wanted to come off of medication. I got married 3 years ago. I was in a great place and said, I don't need anxiety medication anymore. I'm great. Started to come off of it, and seeing a new doctor to help me detox off of it goes, you were on an extremely high dose. You're doing fine the way you are. We did
Okay.
a long process of the detox. After coming off of it entirely, about 2 months in, I started to have these severe leg pains.
Okay.
Yes.
Okay. And this was how many years ago?
This started in 2019.
And we're 2021 today.
Correct.
Okay. Tell me about the pain in the legs. Describe it. What does that mean?
It's an odd sensation. So whenever I try to flex my quad, I'll get severe burning and cramping, and they fatigue out. It's when I try walking upstairs, when I try to do.
Hold on. So
Yeah.
you do a quad set, let's say. You set your quad. It burns.
Mhm.
The whole thing burns? The whole leg, or just the quad?
The quads, and it's only the quads.
Ah, okay. And if you do the right side, does the left burn too, or you have to engage the muscle?
I have to engage the muscle.
You do have to.
I do have to engage.
So if you engage the muscle, the burn is the entire quad.
Mhm.
And once you disengage or relax the muscle, does it go away?
I have to shake it out a little bit. The
Okay.
burning stays, but then it stops.
Okay.
And it takes about, let's say I'm doing jump lunges or wall sits, anything with physical activity, it takes about 10 seconds, 10 to 15 seconds, and then they're shot.
And then what does that mean? They're shot.
They just, they're exhausted, they burn, I have to give them a break. I can't continue with more physical activity. I have to give them time. I used to do
Okay.
hours of cardio. I can't do that anymore.
You're here
Yeah.
for the burning in the legs that is still there
It's still there. It has not gone away
in all these years.
all these years.
Okay. How about walking and hiking?
Walking normally is fine. An incline I can't do.
Decline?
Never really tried that.
Hips? Pain?
No pain in my hips. I don't notice pain. You might tell me different.
Knees?
I do have pain in my knees.
Both knees?
Yes.
One more than the other?
No.
Ankles?
No pain.
Engage the muscle. Engage the muscle. Relax. Engage the muscle. Relax. Engage the muscle. Relax. Engage the muscle. That's it. Okay, and we need to look at it a little different and see. And I don't know where this is going.
No.
This is our first visit. We're just going to see what happens over a few visits, if there's any sort of change. And then we'll make some decisions.
Right.
Fair enough?
Fair enough.
Okay.
Can also talk about my headaches.
You can talk about everything.
Okay.
So that's number one.
That's
is
number one.
burning, cramping in the legs, trying to
Correct.
figure it out. Number two.
Number two, I've had severe headaches since I was in 6th grade, to the point of seeing different doctors, MRIs, brain scans, the whole deal, found nothing.
What type of headache? Top of the head, side of the head, band tension?
Band tension, top of the head. I have a sensation back on the left side.
Are you wearing any thing to bed?
I have a mouth guard.
You
Correct.
do,
Yes.
because you're clenching?
Because I clench.
Okay.
Yes.
How's digestion right now?
Horrible.
Uh,
On top of the headaches, I constantly feel like I'm going to pass out. Constantly am dizzy, nauseous, and exerting myself walking, I get lightheaded and just need to sit down.
light sensitivities?
No light sensitivities.
No light sensitivities. Okay.
And then on top of all that, I have a feeling in my rib cage where I can't breathe. I try to get a deep breath and something doesn't release. It doesn't allow me to get that
Doesn't
breath.
open.
No.
What's most important to you
Most
today?
important are my legs
today.
and my head. Whatever, either or.
Okay, and in the head, the headaches currently you're experiencing are the top of the head headaches? Is it more at the top
It's
of the
more feeling like my brain's going to come out of my ears. Just pressure.
Okay, fair enough. Okay.
I want to feel like I'm not going to pass out every few seconds.
Pass out meaning from fatigue?
I don't know. I don't know what it's from.
Do you feel like this?
No.
What
When
do you-
I'm walking, I just feel like I just have this sensation that I'm going to pass out. Lightheaded, going to pass out.
Okay, and blood pressure is okay?
Yeah, great.
No issue?
No.
Okay, activities currently, what are you doing?
I work out. I do weights. I do cardio to the best of my ability. But
So that doesn't make sense. You're active.
I am. It's not fun, but I'm not going to let it stop me.
Okay.
Yeah.
Good.
Yeah.
Okay, all right.
I get through. My weights have decreased, but I still
What's decrease meaning what, 10%, 5%?
about 50%.
Your weight is 50%?
No, my weights that I
Oh,
use.
your weights.
Yes.
Okay, I'm
Yeah.
sorry. Okay. The nerves that go to the quad, also there's a nerve, part of that nerve goes to the ovaries. How are your cycles?
Horrible. Coming off of medication, I was diagnosed. I never had an issue, ever. Coming off medication, I developed PCOS.
We didn't talk about this.
No, we didn't.
Oh.
I had an ultrasound before I came off medication. I had something was wrong, and ovaries came back totally normal. Fast forward, coming off medication, didn't get a period for 3 months. Went to my OB. She goes, "You have PCOS," and I said, "Where did that come from?" "Oh, I don't know. It just happens." And
Polycystic ovarian.
correct.
So let's go back to the cyst. What's a cyst? What were you told? What's a cyst? This is all great information because people need to know this.
Yeah.
A cyst, you can have a cyst in your ovary, you can have it in your liver, you can have a ganglion cyst in your wrist. And let's look at what is that, or at least this is the way it was taught to me, this is the way I present it. We said earlier that, look, nervous system controls every function, the nerves going to all the muscles, tissues, glands, and organs. Now, every tissue or organ is designed to produce specific proteins.
Right.
So your liver produces liver cells, or the liver cells produce liver protein. Skin cells produce skin proteins. Heart, lung, eye, ear, whatever, right? And all of that is controlled by what? Environment and the nervous system, right? Because we have genes in these cells, and these cells don't express without activation from what? Environment. Okay. Now, if let's just say there's some pressure, there's environmental issue, but there's also some neurological issue. It's not getting the power and information. So now it's not knowing what it's supposed to produce.
Right.
So it produces a byproduct, which are these cysts, and I've seen a lot of these over the years.
Right.
I'm not talking about ovarian cysts in general. I'm talking about a general cyst.
Right.
If it's a ganglion cyst, we look at the nerve, check the alignment, usually fix it pretty easy. Have I seen women who have been under care that had PCOS that resolved? Yes. Do I specifically fix those? No. What am I doing? Balancing.
Right.
So I ask that question because the quad muscle, the knee, and the ovary are all neurologically connected.
Interesting.
Nobody told you that.
No one did. And I have full pearl necklaces around both my ovaries.
Anything else I need to know about you?
Oh, I forgot to tell you about an accident I had when I was a kid. I was in 5th grade and I was with 2 of my friends. They had bikes. I had a Razor scooter. I let them use helmets. I didn't. Hit a ditch in the asphalt, flipped over the handlebars, split my 2 front teeth in half, split my lip, fractured my pinky, and ever since I've had the headaches on my left side. And it's here that goes to the front as well.
Behind the ear?
Behind the ear and the base of the skull.
And it travels up.
Travels up and over.
Got it. Okay.
Yeah.
All right.
Root canals, whole deal.
Okay.
Fun stuff.
All right. Well, we got some stuff to figure out. Let's go over your x-rays.
Okay.
I want to go over a couple of things before the exam.
Okay.
And then we'll figure out where we're going to start. Come on over here, please. This is a picture in time. We have 24 bones in the spine, 23 discs in between. I want you to think of this, Jennifer, as a 24-story building, okay? And the foundation is the sacrum and the pelvis. In order to have a stable building, we need a level base and foundation, which is the sacrum and the pelvis. In this work I do, it's always starting there. If we don't work on the foundation, whatever else is going on, whether you're feeling it here, headaches, whatever it is, doesn't really hold based on what I've done.
Okay.
Okay? So, first thing we need to do is let's look at the foundation and let's see, is there anything off? And let's do it this way. Okay. So, let's start putting some pieces together. Do we have a level base foundation? Is everything looking symmetrical? If you look at the width of the ilia here versus here, this one looks thicker, this one looks thinner. These are all x-ray projections. Let me rewind for a second. It doesn't mean your one bone is bigger than the other. It's an x-ray projection. And based on the way the alignment is of the bone, the x-ray hits it at different angles and it projects different size.
Okay.
Okay? So, I'm layman. This looks wider, this looks thinner.
Okay.
This circle looks different from that circle. Yes?
Yes.
This hip and this hip look a little bit off.
Yeah.
Let's look at your tailbone now. If we look at the tailbone, the sacrum, these are all subtleties I'm just pointing out. So that's S1 or L5 S1. These are the sacral tubercles. Okay? You see what I'm doing here?
You have my discs.
These are individual pieces that ossify at 32 to 34.
Wow.
But what I want you to see is it's so subtle. If that's L5, S1, S2, S3 and S4 are tilting. The bend is here. And it's causing a slight tilt to that left side. Follow my process.
Interesting.
Now let's look at the numbers and what does it mean and what can we do. So here's what's interesting now. Okay, good stuff. We have AS2IN1 on the left. We have a slight 1 millimeter rotation of sacrum on the right. We have a measured difference. This is what's important now. We have a measured difference of 3 millimeters. So the left side is 3 millimeters below the right. So you're tilting slightly, just a little.
Interesting. Okay.
You have a slight misalignment of the left pelvis. If I fix this left pelvis, it makes your hip worse. Okay?
Well, let's not do that.
No, I'm getting your answer.
Right,
Getting your
okay.
answer. Look, it's gone up and in. So if I bring that pelvis down, because there's a number there,
Right.
I was being a little funny there, but if we bring it down, it makes that worse.
Interesting.
Now, we want to keep this under 7. Okay, so even with that, it's still fine. But here's now part of the answer. We can see it's slightly inferior on the left, right? I was telling you it was slightly inferior. The answer is in the tailbone, not in the hip. Will we have to work on the hip maybe later? Maybe. Okay, but the start is going to be in your tailbone.
Interesting.
Follow my process. Okay. So we have a bent tailbone. We're going to go to the AP or the lateral. Let's go to the lateral film and let's look at the sacrum. It should be a smooth arc. You got one nub here, one nub there. You had 2 good falls on your tailbone. Okay?
I know I had one.
You had 2. You'll figure it out, you and Mom. Your L5 disc is fine. Okay, but then what happens at 4, 3, and 2? You're seeing the undersurfaces of the bone because it's tilting. But the discs are fine. If we go back to this and we look at these discs, your discs are fine, but you see that slight curve? Yes?
Yeah, I do.
Okay, now let's go a little deeper. This is important. You're low on the left, so you would expect mechanically, if the person has a short leg on the left, that the curve should go to the left side.
Right.
Yours goes opposite, which makes it even more fun. Okay, all good. All good. So, here's what I want you to see there. Once we fix the tailbone, you can see 5 is off the foundation, right?
Mm-hmm.
4 goes with it, 3 goes with it.
Yeah.
So 5 goes off off the foundation. 4 is a compensation. 3 is a compensation. 2 is a compensation.
Interesting.
1 comes back to level. Oh yeah, and then the next one to go off is 12. 12's major nerve supply is our energy, our chi, our kidney, our colon, transverse. Just saying. 12. From 12, watch this now. 12 goes off, 11 starts to come back.
Interesting.
10 goes off. You see what I'm doing here?
Yeah.
Okay. Alrighty. Okay, now watch this. 10 goes off, 9 goes with it, 8 goes with it, 7 goes with it, 6 goes with it, 5 comes
equals?
back.
Wow.
And 4 is equal with that. Yes?
Yeah.
But then what happened at 3 is twisted. And 3, 1 through 4, this is heart and lung. 1 through 4, this area is heart and lung. 3 goes off, 2 goes with it. This 3 takes everything out. T3.
So that causes issues with the feeling that can't getting that breath, something's getting stuck.
Maybe, but that's different. I'm going to go over that. But what I'm
Okay.
saying is from T3, whatever neck issues you got,
Right.
starting at T3.
Interesting.
T3 coming from 12. 12 coming from
5.
5 coming from
Tailbone.
okay.
Okay.
Now let's go to that side profile. On the side profile, let's look and evaluate the discs and your posture. And this is the biggest thing with your posture, that we're designed to have 60-degree reciprocating curves. The issue in your posture is your whole upper body sits behind your foundation. This line should bisect 7 and 2, the neck. It's like when you do a posture assessment, the ear matches the shoulder, the hip, the knee, and the ankle. So what does that mean? What is the result? The result is these muscles have to work overtime just for you to sit. Right? So sitting, I'm pretty sure, is uncomfortable after a period of time. Right?
I have a kind of like a burning sensation in my upper back where I want to hunch over to relax them all the time.
You want to come back over.
Yeah.
Okay. Does this make sense
It
so
does.
far?
Yes.
Has anyone explained any of this stuff to you?
No.
Okay. Now, if there's an upper cervical, I'll deal with it, okay?
Mm-hmm.
I don't really want to mess around with this stuff at the moment.
Okay.
But we did say on your discs, right? Let's look on the lateral. These discs are fine, 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 fine. This is fine, fine. This is a little swollen. That's your T3. T3 is a little bit swollen.
Okay.
All right, now let's look at the neck. 2, 3, 4 is tilting a little, 5 is tilting a little, 6 is level, 7 is level. Now let's go to the flexion extension of the neck. This is your neutral, okay?
Mm-hmm.
Neutral. These discs are all good. This is tilting. 2, 3, 4, 5 keeps the diaphragm alive. That's how we learned it in school.
Interesting.
All right? So you can see that's kind of pinching back, right? Or it's tilting back, sorry. Now, in extension, it goes back a little more, doesn't it?
Right.
This was what threw me off and misleading. That in extension, okay, that is probably affecting your inhalation. But these discs move, this one moves slightly forward. It should be coming back. And when we go into flexion, it's level.
The opposite. Wow.
It's opposite. So I'm still suspecting this from this. I don't suspect we're going to mess around with this area.
Okay.
But we'll see what we find. Okay?
Okay.
All right, we got some fun stuff to deal with now. So my thought process, let's examine you. My thought process is tailbone, foundation. If there's something up top here, we'll deal with it.
Okay.
Third lumbar is major nerve to the knee, the ovaries, all that stuff.
Interesting.
But that's the sympathetic control of it. The parasympathetic control of it is the sacrum. Okay? Have a seat over here, please. And first thing is, let's evaluate the spine. Let's evaluate overall presentation. Left shoulder slightly higher than the right. That's dishing of the spine. Goes in instead of out. Dishing comes from 6-7 area here. So check it out. You have the curve here. You lose the curve here. You get a little curve here. You lose the curve again here. Are you trying to sit like this? Sit whatever's...
Oh, okay.
Now
Whatever's comfortable.
Yeah, look from the top now. You can see upper body behind the foundation. And this is kind of where she's holding. This is your T12 area.
Interesting.
And this is the area that started this whole process, we said.
And I have issues with my shoulder. I know you said dishing on this side. Something doesn't activate in that area when I try to do upper movements.
So that do the movement.
So if I try to do like a lat pull down, something doesn't activate in that shoulder. You can see it in, I can feel it
I
here.
see it.
Yeah.
Watch.
Something's not.
Do it a few times. Slow. Well, what's interesting is your left shoulder, actually, your left scapula, it looks more pronounced here than here.
Right.
Okay. And the nerves that control the shoulder are base of the neck, C6, C7, C5, C6, C7. Okay? Let's run the meter on your back. Let's see what we find. Starting at the base of the neck, look up a tiny bit. There you go. Huh. I spoke too soon. That's C3, C4. 15 points. My meter reads to 25.
Oh, wow.
It's measuring inflammation. C4, C3, C4. T4. Maybe T5. Maybe. All right. Now, whatever I'm marking here, Jennifer, doesn't mean I'm adjusting all this stuff, okay?
Yeah.
Got it. Hmm.
Can I ask how this thing works?
Absolutely. This is a mini thermography unit, and the idea is this: we have this nerves on the side, right?
Mm-hmm.
This could your ass. This is the idea of what we're doing with this meter, and this meter I use, feel it. It's old school. It's
old school.
Mine's from the 40s.
From the dinosaurs.
It is.
Mm-hmm.
So, functional spinal unit, bone, disc, bone, nerve that exits out.
Okay.
Misalignments causing pressure. Is it the bone pinching the nerve, really? Not really. People say that. They say bone pinches nerve. The misalignment of the bone creates inflammation. It's the inflammation that pinches the nerve, okay? And I'm not talking about severely degenerated discs, just generally speaking. So inflammation is what we're looking for. And this is what Gonstead did, okay? He says, you know, we know when trauma initiates a misalignment, it produces inflammation. So let's see, can I just start looking for components of inflammation, which are, first is heat. That's that. So what this is measuring is, as you go down, it gets to a hot nerve, it's going to go to one side, or a hot inflamed area, it's going to go to one side and then come back to zero once you pass it.
Interesting.
So when you go back to watch it, you can see what's going on, right? So the idea is, where is the difference between left and right side? It tells us where to focus the exam. And as an example, I found pressure here.
Right.
You can complain here. If I don't find pressure there, I'm not touching it.
Interesting.
We're going to
the source.
Does that make sense?
Yes.
Okay, let's
Thank
continue. T12L1. Now let's look at her tailbone. There's that puffiness. Okay, this is that swelling.
Wow.
It's an old injury. She was a little girl. There it is.
Wow.
S3, S4 down into low. Right side.
Could this old injury, just because I'm starting to notice it now, been festering? Or is it an age thing where my spine's starting to do something?
Well, it was developed. What the point of what I'm making is, the body will adapt, right? Body's smart or stupid.
Smart.
Okay, if I hold your wrist like this, or I put a rubber band. If I put a rubber band on your wrist,
Right.
you feel it.
Right.
After a couple hours, what happens?
Forget about it.
Body adapts. We had an old tailbone injury. We're kids. We slip. We fall. Okay, please
Right.
watch that other video of the kid.
Yeah.
We slip. We fall. We get hurt. I'm hurting, Mom. Put some ice on it. Leave it alone. Suck it up. Get on with life. And then you don't feel it. But what happened? The mechanics changed. And the mechanics altered the development of the rest of the body.
Interesting.
Then there's a trigger. And whatever that trigger was starts to manifest whatever was going on. That's what I see.
Interesting.
Okay?
Okay.
So we have S3, S4. We have swelling here. We have T12L1, T4, T5, C4. Those are the majors we're finding. Let's go ahead and evaluate the pelvis. Feet together. Scoot forward, please. Feet together. Open and close the knees. Open and close. Open and close. Open wide and close. Open, close. Good. Right side only. So when you're doing the right, the left is fine. If it was stuck, it would shift with it.
Okay.
Okay? There's a little movement there, but nothing where it's going back and forth like this. Left side only. Yep. When you do the left, there's a tiny little pinch right there.
Okay.
Do you feel that?
I feel your thumb.
Okay. Nothing is sharp?
No.
Good. Sit back for me, please. Let's statically palpate. Head down, please. Round your back. Static palpation. Don't forget to breathe. Right there. Tender there
Yeah.
or there.
There.
The bottom one
Yeah.
or the top one.
Bottom.
That one or even one below.
Well, those are both hot. That one's really hot, though.
Okay. That one hot too?
Yeah.
How about this one?
No.
Okay. Starts there.
Yeah.
Okay. That one's hotter though. Okay. Head down, please. That big one right there, that's the vertebral prominence, C7. T1, 2, 3, 4, Cinco de Mayo,
Sí.
or 6.
6.
6 or 7.
6.
6 is the estómago.
Oh!
Sí. 6 is the estómago. Okay. Same thing, look. The swelling starts here. You can see this all disappears. You can see the bumps here, but then they're gone here because of the swelling. Okay, continue down all the way right to about there. Tender there or there. This one or this one? Neither?
Not really.
Okay. That one or that one? Not really,
Not
yeah?
really.
Okay.
Nothing like the...
Top one. 6
Top
is
one.
definitely spicy.
Yeah, it's still spicy.
Sit up a little straighter now. Let's check the low back. Back towards me. Numero 5. Number 5.
Oh,
Tender.
the flexions, not your finger, just the flexion itself.
Okay. Let's do it this way. That's 5.
Okay.
That's 4. That's 3. 3 ain't tender at all? There's no pressure reading there, but I'm
Yeah.
asking for a reason. If I go to the left and if I go to the right, okay, right is fine.
Yeah, that's
It's-
stuck.
But let's go to 4.
I feel that when
Look here, Leslie. See from my finger, the swelling is still there, the inflammation, pitting edema.
when you tilted me, I felt it underneath my rib cage right in here.
4,
Ooh.
5,
5?
L5. Moving nice. S1, now we're getting to the issue. S2, little tender.
Yeah, tender, but that pain in the stomach.
S3. One more, okay?
Yeah.
Right here.
Ooh.
I want you to feel that.
I do feel that.
You feel the dip from here. S4, look. That's S4.
Okay.
And it dips in. That's that nub I was showing you. Right there. Bend right. Bend left. Let's do this again. S4. S3. Ooh, right there. S2.
Oh.
Ooh. And S1. Okay. You feel it at S2. Yes?
Yes.
How is S3 compared to S2?
S3 spicier than 2.
How about S4?
That one's not fun either.
Okay.
But oddly enough, I'm getting the burning in my legs.
But you're not activating your quads.
I'm not.
T1, 7, 6, 5, 4.
Those aren't too.
Okay, take a nice deep breath in and out. Let's check your pulse. Heart, lung. Tilt back. Take a deep breath in and out. Lean forward. Lean back a tiny bit. Right there. Deep breath in and out. Lean, tilt back. Hurts, right?
Yeah.
Yeah. And it's stressing out your lean field. Okay. Let's walk. And you can see this also. This is the upper body. It's too far behind the foundation. This area is working overtime here. This area is working overtime here. We're looking at these dimples here. They should go up and down. Go ahead and walk towards the nervous system poster, please. Alrighty. Back and forth several times, please. She got a little bit of that tinkle on the right side. It does a little bit of this, hikes up on the right.
And I have a little bit of this.
Right now?
Yeah.
Okay. One more time and we'll get started. Okay. Have a seat. So I think if we're going to do the tailbone, which is that S3, S4,
Okay.
let's do the tailbone first and then see. And there's a reason why. It's going to shift a lot of stuff. I want to do that C4 to help with your breath, but I don't want to do it as a cookbook.
Okay.
And if we're doing that upper thoracic with the sacrum, and I do it, your case is a little different. We have to be very precise and adjust the fewest number of segments.
Okay.
So we know what did what.
Right.
S3, S4, we said it's slightly down on the left side. We'll start it here, and then we'll decide what we're going to do. You're good?
I'm good.
Okay, so I'm coming through it this way, and a slight little, ooh, nice. Chin up. There it is.
Oh,
A little bit more. That's it.
I saw red.
Huh. As you should. You know why?
Why?
Sacral chakra is red. You know your chakras?
Yeah. Wow.
Give it a second. No big, huge crack. It moved. Give it
Okay.
a second. No rush. If you're ready to come off, come off. Hold my hand here. March in place. Make sure we're not dizzy.
Not dizzy.
Let's walk it off once and come back. Thanks, Shisha. Huh. Have a seat. Let's take a look.
Okay.
You survived your first manual adjustment.
I survived. Can I tell you that right in here
Yes.
feels like your thumb is there.
Still?
Yeah.
Okay. Scoot forward, please. Let's run the meter and see if anything changed.
So why do your chakras? Oh, so where am I going?
Just sit whatever's comfortable.
Oh, okay.
If I do my job correctly over the next 2 weeks,
Mhm.
it's going to hurt to slouch.
Okay.
Check it out. That cleared your neck, the C4.
I know I don't quite have a headache right now.
Huh. Give it a second. So this 5-6 area is zeroing out too. No kidding. No kidding. Deep breath in. Now that's completely different. Guess what? That clears your T12 too. Sit up straight. There's heat there, but there's no break. Mira. Very nice. All clear. Check it out. Let's see. Come back towards me. Number 5. Do you remember?
Yeah.
Remember number 4?
Yeah.
Is your tummy hurting right now?
No.
Number 3. Remember that? Mira. S1. Mira. S2.
Whoa.
Mira. Matrix.
I have a little bit right there.
But I mean, I got to go horizontal there. You had to go horizontal there for that. Of course it's going to stretch a little bit. Walk it out a few more times, please. This was an S3 tailbone injury that started this whole process.
So the remnants of the finger area would just be heat.
Ice. You'll like
Ice.
storm. Plus, you're a little sensitive, right? And I was poking around. I'm not trying to be light, and I'm trying to get an answer, help get an answer. But you'll have an ice pack for the ride home, and you'll be fine.
Okay.
Headache right now?
No.
Okay. Humor me. Sit down and contract the quad, and let's see if it's any different, okay?
Okay.
You want to do it yourself, or you want me to hold like last time so we have a comparison? Activate. Activate. Let go. Activate.
It still has a little bit.
Activate.
Yeah.
Activate. Okay. Now you do it yourself.
I have it. I still have the pain.
Okay. No problem. Same.
Same. The
Okay.
same as before, yeah.
Okay. So I'm on the S3. You good?
Mm-hmm.
And I'm just coming through a little more. I want so there's no fear in the future.
Okay.
This way. Okay?
Yep.
Gotcha.
Oh.
That's it. Come on up. Let's close you up. Walk it up. Should be a little bit better. Now you tell me what's different just from walking right now.
Walking, I don't have quite as much of the uneasiness.
Okay.
I feel more grounded.
Okay. One more time, and that's where we're going to start, okay?
Okay.
There's a lot of stuff to just pop an S3, but it's to do it the right way.
Right.
Questions so far?
No.
Okay. So here's kind of the game plan. I'll see you a few times over the next 2 weeks.
Okay.
You're going to start to make notes of any changes.
Okay.
Is it going to be 1 or 2 adjustments, all of a sudden everything is better?
No.
That's not the intent, or I don't think
Right.
that in your case. But we should start to see some changes.
Okay.
Any changes.
Right.
Okay? Good or bad is not
Right.
the issue right now. Okay. In terms of the quads, you can do couple of quad sets in the morning when you wake up, and when you go to sleep, like 2 or 3, you'll know, right? I would minimize trying to do too many weights right now,
Okay.
so no weights right now.
Okay.
Walking, hiking is fine as you can.
Right.
I want you to practice downhill and see.
Okay.
So you'll figure it out over
Yeah.
there, okay? Okay.
Sounds good.
And then we'll go over more of the blood work and take a visit at a time.
Okay.
All right?
Awesome.
Questions?
I don't think so.
I'll see you in a couple of days.
Okay.
Okay?
Perfect. Thank you so much.
Welcome to the office.